Hello, my name is Dr. Charles Modlin. I'm a urologist and kidney transplant surgeon, and I focus much of my career over the last 30 years here in Cleveland on addressing health disparities that disproportionately afflict African Americans and other minority and underserved populations. A few weeks ago, I mentioned to the listening audience that I was going to, during Black History Month, every day in February, Black History Month 2025, have a different health equity focus. And again, this series I call Health Equity Briefs. I'm going to bring to you, the listening audience, information, important health information that I think is important for everyone to know, and especially African American populations, because a lot of the health conditions to which I'm going to speak this month, and again every day, disproportionately afflict African Americans. We call those healthcare disparities. But when we speak of health equity briefs and health equity in general, I want to read to you the CDC, Centers for Disease Control, definition of health equity. Different people, different organizations have slightly different definitions, but health equity refers to the fair and just opportunity for all people to achieve their best possible health, regardless of their race, ethnicity, socioeconomic status, gender, sexual orientation, disability, or geographical location. In general, just means that every individual should have an opportunity, access to resources that will allow them to achieve the best health possible that they themselves can achieve. So on this first edition of Health Equity Briefs, I want to talk about what are the social determinants of health. And so I'm just going to spend a few minutes, and again, this is informal, but I want to bring this important information to you. So social determinants of health are conditions in which people are born, grow, live, work, and age. Research shows that African Americans face significant disparities in these areas. For instance, according to the CDC, African Americans are more likely to live in neighborhoods with limited access to health care, healthy foods, and quality education. These factors contribute to a lower life expectancy. These factors and other social determinants of health, with Black Americans living on average about 4.5 years less than white Americans, both males and females. So addressing the social determinants of health is crucial to achieving health equity. And I might add that the social determinants of health are estimated to contribute between 60 and 80% of the health care disparities that we observe. So access to care, that's another example of a social determinants of health related to socioeconomics. So access to health care is a critical issue, especially again in African American populations. The Kaiser Family Foundation, and that's a great resource you might want to look at, reports that Black individuals are more likely to be uninsured compared to their white counterparts. The lack of health access leads to a delayed diagnosis and poorer health outcomes. And again, during the series Black History Month, I'm going to talk about some examples, health disparities related to delayed diagnoses. So solutions must focus on improving insurance coverage and healthcare accessibility for marginalized communities. What's an example of another social determinant of health? I mentioned lack of quality education, but that also relates to deficiencies in health literacy. Health literacy is a crucial factor as far as the genesis of health disparities. African Americans often face challenges in understanding health information, impacting their ability to make informed decisions about their care. The National Assessment of Adult Literacy shows that only 12% of adults have proficient health literacy. Initiatives aimed at improving health education in communities can empower individuals to manage their health better and to make better health care decisions. So nutrition deficiencies in access to healthy foods and vegetables. Poor nutrition obviously plays a vital role in the cause of many of the healthcare disparities that we see, especially in African Americans. Again, African Americans are more likely to live in food deserts. That limits their access to healthy foods. The USDA reports that 24% of Black households have food insecurity, contributing to a higher rate of obesity and related chronic diseases. Community gardens and nutritional educational programs, again, are solutions that can help address these challenges. So Access to medications is another barrier. Again, if you don't have health insurance, prescription medication insurance, you're not going to be able to acquire the medications you need to treat certain conditions. So again, access to medications is critical for managing chronic disease states. Yet African Americans often face barriers in terms of access to medications. Again, the Kaiser Family Foundation found that Black individuals are more likely to report not being able to afford their medications compared to white individuals. And so that's something that policymakers, healthcare providers need to take note of and come up with better solutions so that everyone will have access to the medications that they actually need. Distrust of the healthcare system, again, that's going to be a topic. That's a social determinant of health. We've heard about the Tuskegee syphilis experiment. I'll talk more about that during this series this month. The distrust that many minorities have due to the Tuskegee syphilis study can lead to a hesitancy, delayed care seeking for preventative health studies. So that's another social determinant of health. Food insecurity, housing insecurity, homelessness. These are all some examples of the social determinants of health, again, that can contribute up to 80% of the healthcare disparities that we see. So I'll see you tomorrow with some other topics for these health equity briefs. Thank you.